Thank you so much for joining us today. I'm Laura Namy. I'm the Executive Director of the Society for Research in Child Development. Today is the third in a series of conversations that we're hosting called At Home with the Child Experts. Today's focus is on the science of stress and coping during COVID-19. The first two of our sessions focused on teaching and learning at home and on screen time. So if you missed those and are interested, they are available to view on our SRCD YouTube channel. We're recording this session also, and we will be sending out a link to this and to the other sessions early next week. I want to thank the hundreds of you who submitted questions in advance to help us identify what topics we could address that would be most helpful to you. A lot of your questions touched on similar topics. You obviously all share some of the same concerns, and so I'll be raising some questions today that will try to integrate multiple parents' perspectives on what their concerns are, and I hope we'll be able to address as many of your issues and interests as possible, even if I'm not quoting your specific question verbatim. It's clear that a lot of families are struggling, and a lot of parents and caregivers are quite worried about their children's well-being. So we will cover as much ground as possible in a relatively short period of time. During the conversation, if you have other questions that occur to you or that arise, please feel free to type them into the questions box that's on the dashboard that you can see on your screen next to the video. So we are monitoring that feed, and we will touch on new issues that come up as we can, as time permits. We're so pleased to have two child experts today. Dr. Joy Osofsky, who is a professor of pediatric mental health at Louisiana State University Health Science Center, and Dr. Brenda Jones Harden, who is a professor in the School of Social Work at the University of Maryland. I would like to just jump right in to see if we can tackle as many questions as possible. And let's start by asking, Joy, can you share with us what does some of the research tell us about how children react in a disaster situation like this pandemic, and how best to support them? And in what ways is this situation similar to or different from other kinds of disasters that researchers have studied?
I really appreciate your bringing up that question, because I have responded to quite a number of disasters. I was a coordinated child and adolescent services following Hurricane Katrina as part of Louisiana Spirit. And one of the things that's very different about other disasters, both natural and technological disasters, is usually they occur in one place so that other people can come in and help. And here what we have is both the people who are helping respond to the disasters as well being affected by it as much as everybody else. The other thing that's very different is that one of the ways that we support people following disasters, children and families, is being with them, being present, listening to them, talking to them, being out in the field, trying to help in that way, which we cannot do with this, with the pandemic. Everything is virtual in many ways. Right. However, I want to talk about the things that can be done and that are very, very important. It's very important for parents and others to have consistent relationships, to be there if possible. I know that everybody's going through anxiety and stress, but be able to be emotionally available and be there and listen to the children. Listening is very, very important, and then providing information to them in developmentally appropriate ways depending on their ages. So that's crucial. And the other thing that's crucial that is very similar to other disasters is the importance of schedules and routines. We have a new normal. Children are home from school, parents are out of work, people are working from home, we're doing so much virtually, but there still needs to be a schedule and a routine with the new normal. There has to be a schedule for bedtime, getting up in the morning, for meals, for if there's virtual schoolwork, for virtual schoolwork, but also there has to be time for, if young children, for play, for older children, time to talk and just be in a relaxed way with their parents or peers or others. That's very, very important. And I know it's very stressful for parents, as it is for everybody. The self-care of parents is very important, which will then allow them to be more available to their children and be there with them.
That's really important. Thank you. So Brenda, we're getting a lot of questions from parents and also from teachers and counselors, other folks who want to be supportive, about how do we talk to our children about what's happening in ways that are actually going to be helpful and not more anxiety producing. How honest should we be? Do we wait for children to ask questions before we talk to them about it? How do we check in and reassure in a case where we don't really know what the answers are going to be in terms of how this is all going to play out? And so what would be your guidance on how to explain to kids what's happening and how to modify our explanations for different ages of children?
Sure. Thanks, Laura. First of all, I think you have to be as honest as you can. And be upfront. As a clinician, one of the things I always use to guide how I thought about working with parents and their children is to say the unsaid, put it out on the table. But obviously how you do it is different, as Joy alluded to, depending on the child's age. So for little people, the kids who are just starting to have language, well, first of all, the pre-verbal kids don't really care. All they want to know is, am I going to get my diaper changed? Am I going to get my bottle? Am I going to have a hug from my mommy? The pre-verbal kids just know about their immediate context. But for the younger children who start to be verbal and hear these things on the news and people talking, I think it's important to talk about it, but be as concise as possible. I mean, 2 sentences and the facts, really easy. And what they want to know, the big question is, Mommy, Daddy, Grandma, whoever, are you going to keep me safe? Are you going to pick me up when I get scared? So emphasizing that you are their secure base, which is a term we use in psychology. Of course, you wouldn't use that term with little ones, but basically you say, I'm going to be here. Mommy's going to love you. Mommy's not going to leave you. Daddy's going to be here, all those kinds of things. So letting them know that you'll be there at times of stress. For the ones who are school age, it's a little different. They have more cognitive capacity, they can think about the future, they can understand complex ideas. So then you want to be a little more circumspect with them. But more importantly, after you sort of explain things, give them an opportunity to sort of express their worries creatively. They're starting to learn how to draw. They're starting to learn how to write. So let them create their own little stories. They can create some imaginative play scenes, do a family play about what we're going to do. You can start to teach them about ways that they can express their worries, writing it down on a little piece of paper and putting it in a jar. I remember my grandmother gave me the little worry dolls, that you can sort of stick in a box and put them under your under your pillow and think that the worries will go away. So be creative, making videos. Now there's so much access to technology. Children can make videos that they can replay when they start to feel sad or scared or things like that have good things, maybe their favorite place in the world. They can kind of go there. And then for adolescents, and I'm living with 2 adolescents right now, I do think it's important to let them have frank conversations. With them, you can certainly look at facts. You can decipher the facts. You can think about what the facts mean for their future, because of course, adolescents are constantly worried about their future, although they pretend like they aren't. And they also are worried if you're going to be there. They don't come to you, so you have to kind of be ready to pounce whenever they bring it up. But I also think it's important to kind of pop in their rooms. Like my kids are, squirreled away in their rooms, but every so often throughout the day, I pop my head in, even though they're now telling me to knock on the door, but I pop my head and say, how you doing? How you go? If you want to talk, I'm there. Again, just the message, I'm here when you're ready for me. So I do think it depends on the age, but I think you have to put it out there.
And Laura, can I add something to what Brenda's saying that's really important and can be reassuring based on the research that's been done on disasters in the past? That most children will be resilient. They may show symptoms of anxiety, they may show symptoms of depression, they may show symptoms of post-traumatic stress. However, with all that, they also show resilience. And the kinds of things that Brenda was talking about that I mentioned, of being there for them and listening, is what really helps support that resilience.
Thank you, Joy. And I think let's re-emphasize that. I think that's really important, that all of us are feeling anxious and wanting to make sure that we're there for our kids and feeling like there's some, scary things going on in terms of their well-being. And we want to address those things in turn today, but to hear that sort of bottom line, most kids are going to be just fine once we get through this, is such an important message to be able to convey. And I definitely want to engage in some of the thinking about how we get through this in the short term, and for some of the kids that might be at risk for not being as resilient, how we can provide that support. But thank you for framing things that way. Joy, I actually wanted to follow up with you about one specific thing that came up from a couple of parents, which is how do we talk with our kids whose family members, parents, caregivers, close family relatives are in the healthcare industry. So folks who are at particular risk because they are being exposed on a regular basis. Do you have any specific guidance for that?
Well, yes, and it's a higher risk situation. And also, we've just talked about how important it is for parents to be able to be there with their children, to listen to them and talk to them. And the healthcare providers are going through so much stress themselves in helping others, plus the fact they want to protect their family. So often they will separate themselves from the family. So we have to be creative in some ways related to that. First of all, we are a number of people, mental health people in the field, are trying to provide more support for healthcare workers as well and their families under those circumstances. But one of the things that I've heard a lot from children whose parents are working and helping others at this time, and helping to the very, very sick people with coronavirus, is seeing them as the heroes. And in fact, I've heard that in some communities, children of healthcare workers have been going around, have developed a project of the blue ribbon, similar to some of the things that happened after 9/11, that these are the heroes and we recognize the heroes. And this is going to be particularly important for the older children that Brenda was talking about, because they actually very much need to have something to do, to involve themselves, and helping in the community can be very important. So seeing their parents as the heroes can really be helpful to many of them. But also listening to the children, explaining to them why their parent isn't as available and why their parent can't be there in person. And if they have the resources, creating virtual ways to be with their parents. I know that they sometimes talk through windows if they're home, using video in some way to communicate with them and telling them that they love them and they care about them a lot, and they're now helping other people. And when people get better, they'll be home with them. So that communication. But I also think that it's very important for the children to not, obviously they're going to miss their parents, but recognize the very important things they're doing. And they may think about things that they can do also to help other people.
Thank you, Joy. So, we've just heard that there's lots to be hopeful about in terms of resilience of children, but I know, Brenda, that a lot of people are expressing some anxiety about long-term effects of the chronic stress that kids are going through and the social deprivation, and are fretting about, what are the long-term consequences of all of this experience for children's emotional well-being, for their academic and physical well-being. And I know that there's a lot of concern about how different communities are being affected differently by this situation, depending on a variety of circumstances, social and economic circumstances and resources, access to information and care. Do you have any thoughts on how we should think about the long-term effects of this for children?
Sure. I think science does teach us that stress is damaging. There's no question about that. There's a colleague of mine who's written a paper about how stress gets under the skin. So we know there are physiologic effects. We certainly know that there are psychological effects. But I like to really use the framework that comes out of Harvard Center for the Developing Child, where they talk about the 3 levels of stress. They talk about positive stress, which obviously COVID-19 is not positive stress, but they also talk about tolerable and toxic stress. And the thing that distinguishes those 2 latter levels really is the caregiving experience that children get. So just as Joy says, the importance of the caregiver, or how the attachment research says, the importance of a secure base. what we know from just a multitude of studies is that we as humans are bound to experience stressful situations. And COVID, of course, is one that we never could have predicted, but it is there. The question is how we are supported to manage those. So for kids, no matter what age, I mean, the how is important and different, but you have to give children the knowledge that is real. And so I don't mean just saying it, I mean acting it, that you are going to help them through this process in whatever way they need developmentally. But I also think it's important to bring up individual differences, which we know a lot about from psychological research, that every child is different. And just like they talk about, you know, COVID is more damaging to people with underlying health conditions, we can kind of think about the psychological impact as being more damaging to children who might already have mental health conditions. So kids who tend to be anxious, you gotta put in a lot more time and energy. Kids who tend to get dysregulated, you gotta put in a lot more time and energy to help them. But the point is, how parents help them really determines whether the outcomes of this kind of stressful situation will be long-term or will not be. But I also think it's important to think about this as an opportunity to give children the gift of teaching them, right? That's what parenting is about, teaching children how to manage certain kinds of stressors. So, you know, meditation and mindfulness is a big thing that's all over the parenting world, right? In terms of helping parents be more mindful and use meditation. We can do the same thing with children. And one of my program partners, they are teaching little preschoolers how to meditate and be mindful. And those little ones are going home and teaching their parents how to do it, right? So you can use that with little people, teaching them to find joy in small things, teaching them what to do when they fall apart, when they feel really scared, you know, all the good things that teachers know how to do. You know, do you need to go to a quiet corner now? These are the kinds of things that parents certainly can do at home. Of course, parents are on roll overload. We're asking a lot of them, that is clear. You can't be a perfect parent, but those are the kinds of things you can do. But I also want to say something about, you raised the socioeconomic disparities. One of the things that I think we can use to help children also is to think about the other. One of the important things in developmental science we talk about is perspective taking, helping children to think about the other. So Joy talked about having children think about the blue ribbons and the healthcare workers as heroes, but we can also think about kids who are growing up in circumstances like crowded urban areas where they don't have access to internet, so can't do their schoolwork, where they don't have access to mass, where they don't even have access to grocery stores, where their parents may not even have jobs, for heaven's sakes, so can't pay their rent. Helping children to think about that, and maybe even coming up with some ways, you know, can they give their dollar allowance to a school supply or food distribution project? Can they, older kids, help their parents tutor? There's some of these programs now where you can tutor children virtually over the, you know, internet, those kinds of things. So helping children really perspective take and think about how there are other people who are even struggling more than they are.
That's great, Brenda. I think that's really important to, you know, give kids a way to channel their anxieties in ways that are compassionate and providing some support for others that they might be able to get excited about and feel more empowered in a situation.
And I actually wanted to, Laura, if it's okay, add one more thing to that. Can I?
Sure.
And what I wanted to add was for the teenagers that Brenda was talking about, they can reach out in other ways. There have been programs that I've heard about now with teenagers reaching out to elderly people, to seniors who can't get around as much, or even connecting with them and teaching them how to use Wi-Fi virtually so that they can stay connected in some ways, which helps obviously the older people as well as the teenagers.
I wanted to remind everyone, if they've got questions that they want to follow up on anything that's coming out of this, to feel free to post in the question box on your dashboard. You know, Brenda, you used the term dysregulation earlier, and I want to unpack that because that's a term that not everybody would be familiar with. But I also think that that sort of leads to a lot of questions we're getting from parents about what would be referred to in the scholarly world as dysregulation. So lots of kids are showing anger or showing fear reactions that are, melting down, oppositional kinds of behavior, having an attitude or screaming at their parents, lots more sibling fighting, that sort of thing. Is that something that we should expect in a situation like that? Is that sort of developmentally typical? And do you have insights for how to help children who are feeling that anger and expressing that anger and lashing out in ways that their parents are like not even recognizing who these kids are right now because they're so distressed? How to help them manage their own stress and frustration?
Well, that's very. Oh, go ahead, Brenda, please.
I was going to say, first of all, I think it's absolutely to be expected, right? We are all stuck in our houses. I mean, we all, as adults, want to have a meltdown. So certainly children who don't have the internal resources that we have as adults are going to get dysregulated, or as you said, have meltdowns and things like that. I think it's certainly expectable, but I do think we have to think to ourselves as parents that family values still prevail. There's certain things that can't happen that are dangerous, like bludgeoning each other as siblings is dangerous and parents have to intervene. But I also think, safety is paramount. We also have to intervene about social distancing, about wearing masks. So there's certain safety concerns like we think about and work with children who have what we call in our field externalizing behavior problems, or children who are acting out or children who are having meltdowns. Safety is paramount. And for me, in this kind of time, that's the only thing that always deserves intervention. I think the rest of the stuff we probably need to be a little more flexible about. So if they're yelling at each other, maybe you can ignore it a little more, put in your earbuds or something, let them try and figure out a way to resolve it as long as it doesn't get unsafe. But I also think, again, this idea, what we know about discipline, right? We think a lot about corporal punishment, and of course, corporal punishment is easy, it's effective, it works right in the short term. It doesn't work in the long term, and it certainly doesn't teach children ways to think about different kinds of behaviors. I think this is an opportunity for us to be good teachers. That's what the root word of discipline is, and teaching children what appropriate behaviors are. So instead of reacting, again, we need to take a breath, kind of down-regulate ourselves, and then respond in a way that really uses the opportunity to teach children and to ask, especially older children, does that make sense? What's a better way you can handle that? I mean, my kids at this point now, they think I'm too psychological, of course, but when I say, hey, they go, I know, I should have asked myself what's a better way. But you start to sort of integrate that, and certainly as children get older, they can come up with the things that they should be doing as alternative behaviors. And little people, you can just sort of help them to do that. So, and I also think it's important to really work on, again, teaching them ways to calm down, to express their anger, the feeling part of it, not just the behavior part, but the feeling part of it, helping them to kind of know inside themselves when they're starting to get upset, and to use words like a good preschool teacher tells your children, use your words for anger, kind of helping them to use their language and their thinking and all that other kind of stuff to help them with the affect, the feelings.
But what's really, it's also what Brenda is.
Joy, I want to jump in because I want to try to shift gears because we're rapidly running out of time, and I want to make sure that we hit a couple more really key questions. So I think that, this is really important in terms of, we need to take a breath as parents. We need to tolerate some things and recognize that this is sort of part of the utility and that there are some opportunities here. But I do want to raise a really important set of questions that we've got from some parents, especially parents who had kids who had some mental health concerns before all of this started happening, or kids who haven't, but are showing some worrying signs. And, the kids that you talked about as sort of being maybe not as resilient. So, parents have shared with us that, inconsolable crying, binge eating, not sleeping, kind of nervous repetitive behaviors or regressing to an earlier age. What are the warning signs for when we do need to solicit help from mental health professionals? And what are the best ways for parents to do that?
Well, this is consistent with what we were talking about before, Laura. First of all, in terms of reassuring parents a little bit, regression is normal under these circumstances. Brenda was talking about that. We expect dysregulation, we expect difficulty sleeping, we expect, some acting out behavior and other types of things. And we also know that parents are going through so much that it may be hard for them to calm down. We talked about the self-care related to that. But if some of the behaviors that are occurring are continuing, they're repetitive, difficult behaviors, and you don't see change, and it occurs over a period of time, then it is time to reach out and have a mental health consultation. Certainly people can reach out to their primary care providers, but they may not have the resources. In every community, there are public mental health outlets that they can speak to. In most communities now, there's a hotline, there are national hotlines, and connected to those hotlines are referral sources. But I think that the message that I was actually trying to add was that a certain amount of regression is normal under the circumstance, but if it's repetitive and it doesn't go away and it keeps getting worse, that's the time that parents need to be able to reach out.
Thank you. That's great. I think this is going to have to be our last question, but it's a really, really important one. We heard from lots of parents in advance, and we're hearing from lots of parents on the session, which is about how to manage their own stress. That parents are under so much pressure. They're managing their own fears and anxieties about what's going on. They're worrying about their kids. They're trying to juggle their work commitments and their family commitments. Can you provide some guidance for how parents manage their own coping and try to take some steps to prevent their children from being adversely affected from their own anxieties and frustrations and fears?
I'll say something quickly and then I'll turn it back to Brenda. Self-care is very important, and self-care is not selfish for parents. They really need to find time during the day for themselves. And whatever helps them, whether it's taking a walk, if there's somewhere where they can take a walk, if it's listening to using one of the meditation apps for them. Calm is a very good one that I've heard people like, Headspace and other things. Breathing exercise, just even deep breathing can make a difference. But that's extremely important for the parents to recognize self-care and include that as a part of their day, whether it's meditation or other types of things. And there also are resources that can help with that. I'm sure you're providing resources and we have that. But it's really important to emphasize to the parents about personal time for themselves a little bit, and that's what they need to do to be able to support themselves and their family emotionally. We also need to think about, we talk about social distancing. We should think about it as physical distancing. Social closeness, emotional closeness is crucial in this pandemic and something that needs to be emphasized. I'm going to turn the rest of the time to Brenda. Speak to that issue.
I agree with everything you said, Joy. The only thing I'll add is that please forgive yourselves as parents. You're on roll overload. There is no way we can do all this perfectly, and to expect that we can. I know many of us have very high expectations of ourselves and think that's the way to parent. I say let it go, forget it. Just do the best you can and know that your children will appreciate mostly the little moments where you're with them, where you give them a little bit of time and a little bit of support and some positive words about how important they are to you. And other than that, don't worry about it.
Thank you. Thank you. That's, I think, very, very important for all of us to heed. Unfortunately, we are going to have to wrap things up. We're out of time. I want to thank you all for attending and thank our experts for sharing their insights and expertise with us. We hope this was helpful during such a difficult time. This is the third, as I mentioned, in the series of discussions on how parents can navigate the challenges of the pandemic. So please keep an eye out for additional opportunities. And we will be sending a link to this video recording early next week via email. It'll also be posted on our website, SRCD website. So please feel free to share it with your families and friends who might find it useful. You'll be getting an email later today asking you to complete a short survey if you have time. We'd love your feedback. We know you're busy, but we'd love to know how we can continue to make these conversations useful for you. From all of us at the Society for Research in Child Development, thank you again for joining us. We wish you and your family's health and as much serenity as possible during these difficult times.